Today on Mission Movement, we're going to show you a unique way of fixing ankle mobility restrictions. Most of us lack ankle dorsiflexion. It's a big problem, and it can happen as a result of previous injuries. Maybe you were in high school playing soccer and you rolled your ankle. It didn't quite heal right. You didn't work on the right stuff for long enough to maintain good ankle mobility. But for many of us, it's not necessarily due to an injury at all. It's just because we have desk jobs. We drive a whole lot. We really don't spend a lot of time in the dorsiflexion end range that we need to call on when we do stuff like cleans, squats, overhead squats, snatches, and the like. One of the biggest complaints that I hear about ankle range of motion, specifically dorsiflexion, is that people will foam roll their calves and they'll stretch their ankles and their calves out for months, even years, and see negligible improvements, sometimes none at all. That tells me that a bigger problem, a more appropriate solution, is going to be addressing the tissues of the ankle joint itself and not the muscles in the area. So today I'm going to show you how to do exactly that. Typically, I don't really recommend people just slap a band on a joint and start cranking away. The shoulder is a really good example, sometimes the hip. The shoulder itself is a little unstable anyways and a little loose, so just cranking on it with a band, while it might get you some results, it's probably just counterintuitive. It's probably not the best result or best way to go, because you're going to end up potentially doing more damage than good. But with the ankle, it's a pretty robust joint and it can handle a good deal of tension. And especially if you've had these really prolonged issues, there's a good chance that you have muscular and joint problems that you need to address. So what are we actually doing with a banded ankle mobilization? This is your foot, and we have three main bones that we care about when we're addressing this type of mobility drill. You've got the fibula and the tibia, they're your shin bones, and then you've got the talus right here, and that's the top of two ankle bones, and it's really the one that we focus on the most in this type of drill, because that's the guy that's kind of getting in the way sometimes of this ankle dorsiflexion, where your shin bones rock forward over your foot like so. Oftentimes what can happen is the ligaments and the soft tissue in the back, along with the calf muscles back here, they can get tight and locked down. And if structures that close to the joint are so tight that they're preventing normal joint range of motion, it's actually going to change the way the joint itself moves. As I had said, in a normal ankle, the tibia specifically is going to slide and glide over the top of the talus right here and clear this little gap right here. So this edge is going to end up down here, and it's a nice smooth arcing motion over the top of the talus. If these structures back here are too tight, then this is going to stop short and it'll almost compress in the front. So if you have, if you've tried our ankle dorsiflexion test, or you notice that you feel a pinching in the front of your ankle during stuff like squats, then this is probably a really good solution for you to try out. So what we're actually doing, we're going to be using a band not unlike so. And you're going to be holding that talus right there in place while you're driving these two bones over the top. In essence, you're trying to distract the bottom half of the joint down and back that way as the top half of the joint goes forward. You've probably seen drills like this before, but one of the biggest problems that I see with banded ankle mobility drills is that they actually place the band wrong. They place it a little too high up on the joint. So if the band is attached to a rig like the upright behind me, then it's too parallel with your ankle joint to have a good, decent effect with what we need. The end effect being the band sits above your two ankle bones. We call these the malleoli, but it sits above the ankle joint. And so that's essentially doing the opposite of what we want. If the band sits here, it's going to pull your tibia and your fibula back that way, which is going to further promote that pinching or the stopping short of a full arc of motion in the front of the joint. Just like this. I'm actually pulling my shin bone back. I want to be pulling my shin bone or pushing my shin bone forward while pulling the rest of my foot and ankle back. So this glide is going to be less effective than what we'll show you in just a second. So we've gone over some of the problems with previous mobilizations or different types of mobilizations. We've gone over why you might want to use this. Now we're going to show you how to set it up. So I'm going to call Nicole or Nikki from CrossFit Habu all the way over into frame here. We tested her ankles probably half an hour ago, and we know that her right ankle needs a little bit of dorsiflexion support, and she's been working on it, so we're gonna try this Mob out and see how she feels. You can do it with 2 different types of bands. I'll show you with this one first, and we'll lead in with this one second. So, come on up. Cool, so band placement, as I had said before, we don't want the band to be sitting too high up on her ankle. We want it to be placed right at the crease. Bring your knee forward for me, please. Good, so see that crease right there? We want it at or below that crease, and it's gonna pull down and back against that talus. Go ahead and set up. Yep, so she's gonna step inside the band and get it placed well, and then she's gonna hold the band in her opposite hand and step down on it. So notice where it is. That looks great. Is that comfortable enough for you?
Yes.
Wonderful. So she has some good tension on it, but remember, you don't need a ton of tension. It just needs to be enough to feel like it's pressing onto the joint, okay? Now she's reaching over and grabbing the upright of this rig to try and take some of the weight off of the foot. Remember, this is a banded joint distraction. We're trying to separate the joint. So if she's loading this front leg, it's compressing the joint, and she's not able to get as much of an effect as we're hoping to get on the back half of that joint from that band and that pressure being applied. So her weight should be on her back foot, and she should be leaning into her hand. She can also use a PVC pipe if needed, but we're not going to do that because we have access to this today. This is an option for you at home if you're doing it somewhere that doesn't have a rig. Thank you. Okay, so just like with our test, she's gonna bring her knee straight over the middle of her foot. One thing we don't wanna see is her knee to rock inside of her big toe like so. That's gonna cheat the range of motion and give us a false sense of getting the work done that we're looking to get done. If you're gonna do this before lifting, typically we don't wanna stretch for long periods of time right before you go and lift. So if this is a pre-squat session, for instance, I'm gonna have her do 10 to 20 reps of this undulating knee thing. She's gonna bring it forward, she's gonna hold it for about a 3 count, maybe a 5 count, and she's gonna come back, and she's gonna repeat that 10 times. So just do a few more for me, would you? Wonderful. And one more. Great. And relax for just a second. Now, if you're just doing this because you know you need it, you're not necessarily about to go hit a heavy squat session, and you have some time to kill, then I would recommend holding it for far longer. You could hold it for tens of seconds, so 10, 20, 30 seconds. You could hold it all the way up for 2 minutes in this end range position, as long as you're comfortable enough doing that. It is a lot, so it's okay if you can't. Come on in. So she would just hang out here, and hang out here, and hang out here. Those more dense ligament and capsule tissues, they tend to take a little bit longer time to release than a muscle would. And you can relax. Now the other option, you can take that off, is to use a simple loop band like this. The setup is exactly the same, but she's just gonna use this. Now with this one, you wanna step on your bottom foot first, and then place your foot inside like so, okay? Cool, and it's okay, you see how the band is rolling? As long as your skin and if you have leg hair, as long as it can tolerate that, that sort of interesting sensation, maybe getting torn up a little bit, it's fine. It shouldn't be discomforting, but this isn't doing her any harm. Notice that the band is still in that same spot at the base of that ankle crease below the ankle bones, and she's just gonna do a couple more reps for us just to see for the folks at home. Wonderful, so one thing I noticed there, she wants to keep her foot flat as she glides forward. Wonderful. And come on back, and you can step out. This banded ankle mobilization is really valuable if you don't often get into that big ankle dorsiflexion end range that you hope to achieve. So people like desk workers or pretty much non-laborers, if you don't squat very much, if you don't spend a lot of time doing mobilizations, and or if you've had an ankle injury in the past, and or pinching in the front of your ankle when you do certain movements like squatting, cleaning, etc. It's really valuable, and it can help open up new ranges of motion that you didn't know you had. It's worth noting that if you haven't gone into deep ankle dorsiflexion for some time, you probably have both muscular and joint tightening. So doing this alone probably isn't enough to get you feeling perfect. You're probably gonna have to do a little bit of both, foam rolling, stretching, and these joint mobilization type movements to get you there, but that's okay. If you like this video and you think you got something out of the banded ankle dorsiflexion mobilization, then please click like and subscribe. We have a lot more great content coming your way.